The coronavirus shutdown 6 weeks and counting in Wisconsin. I'm Adrienne Pedersen. Today on Upfront. A little good news, a doctor who says we're making progress in the fight against COVID-19. Plus, some meatpacking processors close. Could this cause a disruption in the food supply? And
this is a little bit of a flashback for me.
A survivor of the 2009 pandemic, his message about healthcare and the economy.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us. Wisconsin is now in its 40th day of Governor Evers' coronavirus stay-home order, but the case that could change that is going to the Wisconsin Supreme Court on Tuesday. Republican lawmakers, as you know, sued the governor over extending his stay-home order until May 26th. The Supreme Court will hear arguments via video conference Tuesday morning. The governor last week allowed a few types of businesses to reopen, but Republicans and the state's powerful Chamber of Commerce want businesses to reopen sooner, especially in rural areas that haven't been hit hard by the virus. On Friday, state health officials reported a spike in cases. The numbers in Brown, Milwaukee, and Kenosha counties have climbed. But a top doctor says overall, we're still making good progress against COVID-19. I talked with Dr. John Raymond, president and CEO of the Medical College of Wisconsin.
I think we've done an exemplary job of slowing the spread of COVID-19 in Wisconsin. In many ways, our approach should be a model. The process, I know, has been very challenging and difficult and frustrating for all of us, but we seem to have reached an equilibrium with the pandemic, and I think that's really good progress for all of us. And over the last month, we've developed new tools that we need to stay on top of the pandemic, with substantial amounts of new testing coming online and a public health infrastructure that's been mobilized that'll allow us to identify COVID-19 infections quickly and to trace and isolate the contacts of those individuals. So good progress.
And when we look at some of these benchmarks, like the 14 days of a downward trajectory, a percentage of positive tests, how close do you think we are to something like that?
Yeah, that's really tough. I think that we've reached a peak and we're in a plateau phase with some indication that we're slowly decreasing the numbers of COVID-19 infections in our state. But it's hard to know exactly where you start with the 14 days and whether a single day that might be an outlier would restart the clock. But I think it's important to know that we've already begun to slowly open our economy in phases here. Governor Evers has relaxed the safer at home order twice now. And I think that phasing is really the most responsible way that we can open up our economy and try to resume some semblance of normal life.
And in talking about that, what does it look like to open things back up safely, in your medical opinion?
Well, I'll refer to the Badger Bounce Back Plan, which is very similar to Trump's plan to reopen America again. And basically, we start with parts of the economy where there are few interactions between the consumers and the employee. So those are so-called safer interactions where you can practice easy social distancing. And those might be outdoor activities, grocery stores, and some personal services that can be done by curbside drop-off. What becomes more difficult when you start to turn up the dial is where you have higher intensity, higher frequency, higher duration interactions between people. So, for example, restaurants and bars, large capacity sporting events, those are probably going to come further down the line when we're sure that what we've done hasn't caused a new surge of coronavirus infections here.
What will the summer look like in Wisconsin, do you think?
Well, we always have beautiful summers in Wisconsin, so I know that at least outdoors it'll be nice. And I think people will again be resuming some semblance of normal activities. But we're probably going to need to exercise social distancing, good hand hygiene, and probably cloth face coverings out in public places for the foreseeable future until either the virus is extinguished or there's a vaccine that's effective for it. And it's likely that we're going to be living with this virus for at least another year.
And when we hear from national medical experts, they always say that every state is different and what's happening in the states is different. So in terms of looking at Wisconsin and this surge in the fall that we've heard about, what is your concern there?
Well, I think all of us are concerned that, like the flu epidemic of 1918, that the coronavirus will have a second wave in the fall. And what will be challenging for us about that second wave is it's likely to occur at the same time that we're having influenza. And so distinguishing between those two diseases is going to be a challenge for us. But I would say I believe our country and our state are well positioned to deal with that challenge. We have outstanding health systems here. The testing capacity has increased and the tests have gotten better. And the public health infrastructure in Wisconsin is particularly good. And I believe that all the efforts they've made to coordinate how they do the contact tracing is going to really serve benefits to us in the fall.
How confident are you that students will be able to return to classes as usual in the fall?
I think it's a coin toss right now, and obviously the MCW is an institution of higher education, so we're thinking deeply about this. I think it's going to be in phases, and it's really going to depend on how well we do as we turn up the dial over the next couple of months. I think everybody knows that younger people in general are less susceptible to COVID-19 infections and that they tend to fare better, but that doesn't mean they're completely immune. And this is something that I think, especially institutions that have dormitories and common cafeterias, are just going to have to see what happens over the next month or so before they commit to having on-site education. Now, I know nationally, Purdue University and Liberty University have already said they're going to resume full classes in the fall, but I think that's probably a little bit risky right now.
Where does Wisconsin stand when it comes to testing? That's another big thing we hear about.
We're actually doing better than most states in terms of testing. I know that the governor, the legislature, and our manufacturing companies have taken this seriously. And I want to call out a partnership between the state of Wisconsin, Promega, and Exact Sciences to provide 85,000 tests per week for COVID-19, and those are being rolled out right now. Our capacity now across the state is almost at 85,000 tests a week. It's a little over 11,000 a day, and that's light years ahead of where we were even a few weeks ago.
Dr. Raymond, we appreciate your expertise on this. Thank you.
Thank you, Adrian.
Coming up, meat packing plants shut down due to coronavirus among workers. I'll ask how concerned we should be about the nation's food supply, and later.
And I wound up staying for a month in a coma on a mechanical ventilator, sort of living through this experience of surviving a viral pandemic in an ICU.
A survivor's story, a man who lived through the 2009 flu pandemic, on what's ahead for some COVID-19 survivors.